In male cycle, desire. In female also desire. Instead of erection, in the male, female is a lubrication. Lubrication. And orgasm is common. Male get the ejaculation, female get orgasm, and absent resolution last. Is absent in the female. Resolution means what? After ejaculation, male needs some time. 10 minutes, 20 minutes, even 1 hour, maybe 6 hours, maybe 1 day, some patient says. But female don't need time. There is no resolution phase. According to Master Johnson, there are 4 stages: excitement phase, plateau phase, orgasmic phase, and resolution phase. But the resolution phase is absent in the female because their clitoris, sex organs are the externally, or they don't have to these things particularly. They need more and more even. Means orgasmic phase is need orgasm after, even after sexual act, they need to close or clitoral stimulation. Nobody is doing that stimulation. So the female again become lack of desire or low libido is increasing in female partner. Now what is a feminist woman says? Woman's sexuality is neglected. Whatever a female author says, many pages are devoted to the penis, while vagina is shown as a gaping hole or as a tunnel, tube-like deflated balloon. Several myths in medical profession that vaginal orgasm is not the clitoral stimulation leading to orgasm. Vigorous contraction of orgasm come from pelvic and clitoral muscles in response to clitoral stimulation. Okay, fine. Many women don't experience orgasm until they are in 20s or 30s or even later or never. These are the most of the opinion during the counseling, because each and every patient we can't ask during our OPD basis. OPD basis in counseling we have a lot of time, 45 minutes we have to spend with the patients. So that's timing we have to ask each and everything to them, that we understand their stories accordingly. This what Indian woman says, it is not true that woman has more desire for sex. Indian woman also said like, unlike men, woman doesn't seek extramarital relationship. She will sacrifice everything only for being loved by her husband. For sexual pleasure, woman is not dependent upon man. Intercourse is necessary for fertility, but not for woman's sexual pleasure. Love, romance, foreplay, and trust has more role in sexual intimacy and sexual pleasure. Now, short term, this is already I covered. I don't want to bore you a lot because number of things I want to practical approach. I am a person very practical. You must get the fruitful procedures. So that is the effective one. Now, PD basis management and pharmacotherapy. A little bit you should know about the pharmacotherapy also. If those who have not received all these notes, just ask me. I will send them. Those we are sending the notes only for registered students, because then there will be some bias. Registered student paid the money fees for the various institutional fees and all, and that should be. I don't. Anybody can attend. That is a different story. But that things I kept exclusively for those who paid the fees. They can disturb me anytime. Correction of any organic etiological factors, psychotherapy, and counseling. I told you counseling role is more. 90% role, 80 to 90% role is psychological. Whenever patient come for erectile dysfunction, you always find out whether it is psychogenic, whether it is organic, whether it is a vascular blood flow and other things, whether it is other secondary disease like that, trauma or accident, whatnot. You have to find out these things. Approach recommended in stage stimulation each partner and all. This is a actually sensate focus. foreplay is proper or not, psychotherapy and counseling is important, correction and organic etiological factor is important. Anyway, androgen therapy is needed in hypogonadism cases or in older above 60s, 70 cases testosterone injection, 250 mg once in a week for 3 injection to 6 injection course you can give them. Deep intramuscular generally we are giving, something is written here, something interval between injection. Okay, fine. Andriol testo capsule is also available, but 120 to 160 mg you have to give. That is a costlier affair that goes around 3 to 4,000 rupees per month, and injection I think 200 rupees or 250 rupees, and 2 injections in a month or 1 injection in a month is very cheap. You can give the injection. Hormonal therapy is over, follicle stimulating and all. Hormone, another, we are not using other hormonal therapy in, particularly in the male. Even most of the doctors are tried testosterone injection for the low libido in female, but is not so far fruitful or result oriented therapy, because more than 60% people are happy, then we can say it's a real therapy, or minimum 50% above. Oral therapy, everyone know, sildenafil, usually dose is 50 mg, taken 1 hour before sexual activity. Based on effectiveness and tolerance, just